translation in 10 languages, in English, French, German, Spanish, Italian, Portuguese, Polish, Swedish, Lithuanian, and Hungarian. And as usual, I would encourage you to speak slowly and clearly to help the interpreters. So it's my huge honor to welcome Bill Gates to the DEVA committee with ITRE invited. We've had earlier an exchange on the remarkable work that you have been doing, and this is the 25 years anniversary of the Gates Foundation. And this anniversary falls at a time when we all know that there are shrinking budgets, and the extraordinary fact that the Gates Foundation is now the biggest donor to World Health Organization and to Gavi really, I'm afraid, tells the positive story of Gates and the rather negative story of the US government and member states. So this is a major challenge, and we are facing into Gavi replenishment. So we very much look forward to hearing Mr. Gates' reflections on those changes that are taking place. And of course, the focus today is on innovation. And as we all know, innovation plays a critical role in development, particularly in things like cash and digital payments, new vaccines, water and sanitation and hygiene. And just as innovation requires good management, it requires long-term funding. So these are the issues that we are dealing with today. So following Mr. Gates' address, there will be a question and answer session. We will begin by giving the floor to the Vice Chair of the ITRE Committee, Mr. Giorgio Gori, who is with us, replacing Mr. Budka. We will also give the floor to the Chair of the Sant Committee, Mr. Jarubas, who is also with us here, and subsequently the DEVA coordinators, if time permits, and therefore I encourage everybody to keep their comments as short as possible. We will be able to open to a catch the eye at the end of the meeting. So with that, thank you very much again, Mr. Gates, and I give you the floor for 7 to 8 minutes. Thank you. Thank you.
Well, thank you so much, Chair Andrews, for the invitation to be here, and I'm grateful for the opportunity to speak and look forward to our discussion. You know, over the last 25 years, the world has achieved a lot. You know, one of the greatest improvements in human welfare has been the incredible reduction in childhood death since the turn of the century. We've cut those deaths from almost 10 million to now less than 5 million. And so that's the track record that we're trying to carry forward to achieve the Sustainable Development Goals, which would ask us to cut those deaths in half again. Unfortunately, because of funding challenges and debt challenges, with the world having lots of priorities, we're now facing a global health crisis. Unlike the pandemic, you know, which came along and was not caused by humans, this crisis is largely one of our own making. Poverty and hunger are on the rise for the first time, and more children will die this year than died last year. The poor countries where most of the deaths are paying more on debts in many cases than they're able to spend on their basic necessities like health and education. And because of these top priorities, what we see is that foreign assistance from across the globe this year have gone down by over 30 billion. Of course, my country, the United States, has made the biggest cuts, but the United States is not alone. Of course, in my time in Africa, in both Ethiopia and Nigeria, a few weeks ago, you know, I was able to see, you know, what it means to no longer fund TB case detection, to no longer fund handing out malaria bed nets, you know, to have medicine stuck in the warehouse. So the, you know, abruptness and the scale of these changes challenge us to prioritize, to rededicate ourselves to these things. Already, children have died of HIV who would have been protected with medicines that only cost 12 cents a day. Already we're seeing malnutrition, which is a terrible scourge, going up. And we also see that the risk of a pandemic is greater when we allow these developing country health systems to break down. So the monitoring of avian flu and Ebola, many of those people have been let go. And so our early warning system that would allow us to stop a pandemic before it spreads globally is weaker today than it has been or than it should be. So, I believe we should do everything we can to mitigate this, to drive innovation, and over time recommit to these areas so that we can get back to the improvements that we've had for the last 25 years. Europe, it should be said, has always been the most generous region in the world. The aid budgets are substantially higher than other places, and that's why in all of these fantastic efforts, like Global Fund and Gavi, Europe's been there and it made a huge difference. Particularly in global health, our ability to measure our impact has gotten extremely good. The field at the turn of the century was pretty weak in terms of knowing how many deaths there were, exactly what was causing those deaths. Today I can say that this is a very well-measured activity. We know which programs work. We see very quickly if they're not working, and we're able to make sure this money is very, very high impact. Some of these, the progress is invisible to people, and so the setbacks are likely invisible, and we have to work to change that. The reduction in poverty has been such that as we look forward, almost all of the poverty, over 90% of the children in poverty in the rest of the century will be born in Africa. And so the great success of a number of Asian economies, India, Vietnam, Indonesia, has meant that they've largely graduated from being aid recipients. And so we can take the generosity and apply it to the countries most in need. That's true for Gavi, where 19 countries that were recipients of Gavi aid now are completely financing the vaccines, even though they still get immense technical and procurement support and very low-priced access through the help of Gavi. Tomorrow, with the very generous hosting of the European Union, we're having the Gavi replenishment. That's something we do once every 5 years. And as I said, you should be very proud of both your member states and the European Union contributions to Gavi. Gavi saved over 19 million lives. And so when we think about saving lives in rich countries, we spend over $1 million to save a life, and here it's done for $1,000 to $2,000. And so, we are treating these lives as having value, not equal value, because of course we do it with only a few % of the budget, but that should help us to get these countries, virtually all these countries, out of the poverty trap, have them rise up to middle income level during the next 20 years. The benefits of improved nutrition and health really do power these economies. When you talk about the demographic dividend, that makes the assumption that the kids are healthy so that they can be educated and so they can make a contribution and lift their countries up. And that's what we're going to help make possible. Of course, Europe's very involved in the innovation, making the vaccines. A lot of these were both designed and manufactured here in Europe. People like GSK, one of the highest impact vaccines, that Gavi has financed is one for the thing that causes most diarrhea called rotavirus. And we've gone from getting really 1% of kids in poor countries who had access to that vaccine. Now over 80% of children get that vaccine. We have very innovative companies like BioNTech in Germany, which is a great example of innovation. Of course, their vaccine saved millions of lives during the pandemic, but they're also working with the Gates Foundation on vaccines for malaria, TB, and HIV. Beyond vaccines, you have companies like BASF that helped design a new generation of bed nets that avoided the resistance that had been developed, so it's twice as effective. And they were able to drive the price of that down dramatically. So, we should learn from the past and what's worked, and even when we have scarce resources, make sure that we're prioritizing the right things. The challenges ahead across the board are very significant. Collectively, working together on these things, using multilateral institutions that develop critical mass and deep expertise will be part of the solution. For my part, in May, as I had the chance to celebrate the 25th anniversary of the foundation, I made the commitment that over the next 20 years, the wealth that I have personally in the foundation will be spent against these causes. And so the goal is not to do these things in perpetuity. It's to help these countries be lifted up and have them be self-sufficient. I think this is a cause that rich countries and rich individuals should engage in. Europe's always had a high bar for what is viewed as generous, the 0.7% of GDP, and I hope that over time more countries can work and give at that level. Very small amount of money as a percentage of these budgets literally make the difference in millions of lives. And I'm accelerating my giving not so much because of this crisis, but because of my optimism that as these budgets get restored and as the innovation pipeline, which has incredible things that make me feel not only can we eradicate polio, but also malaria, and dramatically reduce all the infectious diseases, including HIV, during these 2 decades. So it's given out of a sense of incredible optimism. So I thank you for all the partnerships we have in Europe. You continue to stay true to the values represented by the Sustainable Development Goals, and I look forward to the work that we'll do together. Thank you.
Thank you very much, Mr. Gates. And we will now go to interventions from the members. But first of all, we start with the Vice Chair of the ITRE Committee, Mr. Giorgio Gori. You have the floor, Giorgio.
Thank you. Good morning, Mr. Gates. Thank you for being here. I will speak in Italian. So,
in the past few years, governments, NGOs, and a lot of private actors have done major things to improve health globally. We're now in a major crisis. There's a lot of instability. There's a lack of resources, the capacity to impact on the global health situation. The governments are cutting their budgets, and we've seen the case of USAID. This is undermining the purpose of funding. According to Oxfam, the 95 million people may be deprived to basic health services. The leadership when it comes to global health is diminishing. There's a need for a long-term approach for the future. We have to rethink the priorities when it comes to global health. Investing in health in poor countries is the best way to boost their income, their wealth, and the situation of their people. So if we're going to see this backsliding, look at the situation in AIDS. And the pandemic meant that it was clear to us that national borders do not do the trick. Globalization, urbanization, climate change, those are the main factors that help to spread diseases in isolated areas and give rise to new pathologies. This is why we need a global, coordinated, cross-cutting approach. Investing in weak services is a way of improving the global community. It's something that will benefit us as well in the long run. So how do you think that there could be a new approach as regards global health? The Gates Foundation has done a lot in terms of investment, has done a lot and has shown great results. But what we need is a wider understanding of how vital global health is.
To Mr. Jarubas, who's chair of the Health Committee.
Dear Mr. Andrews, thank you for giving me the floor. Thank you, Mr. Gates, for the opportunity to talk to you about what we do in the Committee on Public Health. We just adopted our work program, and I wanted to mention a few points. For rare diseases and women's health. On these two subjects, we have in the beginning of this term public consultations. In both these questions, it is very important to listen to the citizens. It is essential to hear what are the problems and struggle of parents to children with rare diseases or later in life grown up with such diseases. What is stopping them from getting the diagnosis and care they need? And it is equally important to listen to women. We have been told by an organization led by Leo Varadkar that if women would get the same health care as men, the gain for the EU economy would be hundreds of billions annually. To understand why there is a gap in the health care of men and women, we must listen to women, and that's why what we have done. We will also work on the continuation of Europe's beating cancer plan and on a cardiovascular plan. These are two of the main killers in Europe. But Europe is not an island, and that is why I want to finish by commending you for the work you do for global health. It is worrying to see how support for essential health projects in many parts of the world is disappearing, which in the short term means that lives that could be saved are lost. But even more importantly, in the long term, this sets back our efforts to provide good health care to all on this globe. Thank you very much.
Thank you very much, Mr. Jarubas. And now we go to the coordinators, and we'll take 4 questions. First of all, for EPP, Lucas Mandel.
Thank you, Chairman. Thank you, Mr. Bill Gates, for visiting us. It's a pleasure and an honor to have you with us today, especially in these times of, I would say, false prophets, to have a true entrepreneur, a person who is a facilitator, a visionary, and also a person with true, not only corporate social responsibility, but personal social responsibility, as we have seen today. And it means a lot to this Parliament that you are visiting. And I even recognize that your tie is in colors of the European Union. So obviously, I take it as a positive symbol today. I also want to, in particular, thank you for mentioning the Sustainable Development Goals as something I guess each sane and sober person can agree on as our goals altogether for this planet. And thanks for pointing out the main factors of the global health crisis, as you have called it. I want to in particular address you with three areas and put questions on that to you if you have a response to it. You've pointed out childhood death, which is really a severe issue, and that this year, as you have said, will more children die than the years before is something we should not accept. We should be active on that. And food security is very much connected to that. And we also see a decrease of food security worldwide. This might sound as a political question, it is partly one, but could food security be something also the recent US administration can agree on and also can agree on coming back in the field of humanitarian aid when it comes to food security? Second question is with regard to mother, parents, child passports. In my home country, but also in other countries, driven by main actors, the idea of treating and supporting, especially in the beginning of a childhood, a family, mother, parents, child together, seems to be important. And the third question, to be very quick, is about public-private partnerships. The European Union calls it Global Gateway, our positive outreach to the world. How will it be possible to take more private sector actors on board when it comes to positive contributions here? Thank you again.
Thank you. Next for S&D is Udo Bullmann.
Thank you, Chair. Mr. Gates, great to have you here. Since your work is extremely innovative for decades already, the public debate on development is unfortunately not always of that kind and not everywhere. We have a new buzzword in the discussion: let's get more transactional. I have studied this Latin origin, and it means for both of us it has to be of good use and fortunate for the perspectives that we invest in our societies. But unfortunately, it has very often a very flat interpretation, short-minded and short-term oriented. And that is the excuse for more and more reducing ODA towards what a short-minded interpretation of economic advantage could be. But that argument doesn't stand reality. When we are investigating on economic progress and economic success, for instance, in the Southern African SADC Association, we find proof for the fact that decisive is whether you have good health systems, whether you have proper education, then you have a strong workforce, and then you can rely on the fact that the added value that is produced stays in the country. So isn't it a question of innovative, that we discuss in a new and fresh mindset the relationship between human development and economic success? Couldn't that be of the advantage for our political debate also in Europe, as well as worldwide? And do you feel a certain sensitivity when you talk to political leaders and business people for that? I would say this is of the essence because mindsets rule the world and produce better or worse results.
Thank you, Udo. Next is for Patriots is George Halvany.
Thank you, Mr. Chair. Thank you, Mr. Gates. I'm happy to see you here, and thank you for the briefing that provided. I have the opportunity to serve the different kind of things, as a standing rapporteur for education, and I'm focusing on it. And I would like to ask you about the activities your foundation, the field of supporting the access to education. And of course, it's not a task to private foundation to cover all the gaps, and of course, and that's nevertheless, your engagement plays a key and guiding role. I would say the guiding role for other donors as well as for partners countries. The very short questions only. That's the education. First of all, it's a long-term investment, and secondly, it's
It's all the time you have to cooperate with the local governments. Without governmental cooperation, it's not possible. And how do you see the possibilities to use the funding to facilitate the governments to make more responsibility for their own people and take political and budgetary commitment, mobilize domestic resources funding for the education? This is, I think, is a base of cooperation. And finally, I'm happy that this we say all the time it's very important, job development, bring the people together. You've done successfully, never seen so many people in the same room for the development committee meeting. Thanks a lot for that.
Why did you give away our secret? The next speaker for ECR is Mr. N. Salvini.
Grazie, Presidente.
Thank you, Chairman. And thank you, Mr. Gates. Today, this is a very important event because we're talking about development. And these are countries that are going to be playing key roles in the next decades and centuries. As you said, Africa needs development, technological innovation. It needs health facilities. It has to be able to fight famine, and you talked about good practices and solutions, but I would like to ask you quite frankly, at what cost? Quite sincerely, you sponsoring abortion in Africa. We think that there's GMs being used in agriculture in Africa. We don't think that's a good idea. That can end in catastrophe for the whole world because it's a deprivation of liberty, deprivation of food sovereignty. And when it comes to the multinationals who come up with their models and export our Western approach, make them legitimate. Is that something you really want to do? Because I wouldn't agree to that. Or I think, shouldn't we be respecting African customs, the people there, and investing in them and work out the appropriate approaches with them? That's what I'm asking you, because I think Africans, just like everybody else, has the right to share their own future.
Members, and now we go back to Bill, and you have 4 minutes. Well, do your best. Thank you.
Great. Well, a lot of what was said, I'm in total agreement with. Let me touch on agriculture and education that I didn't really mention in my opening remarks. The Gates Foundation, we're primarily focused on global health. We spend over 35% of our money is the research and development of funding the creation of new tools, and we spend about 35% on delivery partnerships, including polio, Gavi, and Global Fund. The other 2 big areas for us that are each about 10% of our overall spending are agriculture and education. I wish we could spend more on education. It's a very important thing. The magic formula for uplifting a country is to have kids who are healthy and well educated, and then if you have those 2 things, you've got the key ingredients. It's great. There's a lot of good work going on in education. For example, there's a thing called structured pedagogy that a number of countries have adopted and seen very, very good results. So we look into the future. There's a question of how AI might be used in education, and given the need for better education in these countries, we should make sure that it's not just the rich countries that are adopting that, but that we make it available broadly. It's early days for that, but I would say some of the pilot programs where we're using AI in education do look very promising. For us, AI will touch on all of our work. We'll use AI in our health research work. We'll use it in our health delivery work. For example, a pregnant woman would be able to talk in her local dialect about the needs and when does she need to visit and what symptoms does she have to make sure her pregnancy goes very well. Let me now touch on agriculture. Absolutely, each country will decide exactly what their policies are in agriculture. African countries are net importers of food, and they suffer from very extensive malnutrition. And they face the challenge of climate change, which the closer you are to the equator and the poorer you are, the more these weather effects hurt you. And so the damage of climate change is way more in these poor countries than it is in all the rich countries. And so, they're the victim, even though they did the least to actually cause these problems. There is an opportunity. For example, we've done work on chickens, and that is a wonderful thing because if you give healthier, more robust chickens, women get far more income because they're the ones who take care of them, and the cost of the protein that comes from the eggs. In Ethiopia, for example, where we've had these new chickens working with the government, the cost of eggs is less than half of what it was, and so it's getting out to lots of kids and helping women there. The same things can be done with livestock to retain the disease resistance and heat tolerance while raising productivity. In seeds, there are a variety of things. There's conventional breeding. There are gene-edited seeds. There's new ways of making fertilizer, so-called biofertilizer, that will be far less expensive. And again, here's a case where if African farmers have never had good weather forecasts. And so actually by using AI, we can give them far better weather forecasts than even rich farmers in Europe or the US have had in the past. And so they can get advice about which varieties to plant, when to sell, how to deal with any diseases that come along in their crops, just taking a picture and getting that advice. And so we're already rolling those systems out. And so agriculture, I see, is very important. And that's one where once you launch something like a chicken hatchery, then the private sector comes in and you can move on to work in another area. So I think I hit many of those points.
Thank you so much. Okay, we'll go to the second round then, and to start with for Renew is Charles Goerens. You have the floor.
Oui, merci, Monsieur le Président.
Thank you very much, Chair. Now, it's the third time that I have the privilege of meeting Mr. Gates. The first time was in 2010, and I remember I heard him make a very important call for regarding his work, and then the next was in 2018 when we held an exchange with him on a financing instrument with Global Europe, and this is now the third time. Now, this time is so destructive that a lot of the things that we've achieved are now being put into question. And we are looking at very important refinancing. You were talking about Gavi, and we should add into that the Global Fund fighting AIDS, tuberculosis, and malaria. So we are going to the different international communities to see who's doing what and who's financing what. And the result now, after the destruction of US aid, after the very big reduction of many budgets in our countries and our member states, and also some Asian countries, there are very few funds left to respond to all of the expectations that we have. So the question now is, how are we going to set priorities? We've got humanity against development. We've got the World Health Organization against direct financing on the ground. We've got Gavi or Global Fund. Can we do both? But in any case, we're going to have to set priorities. And so what do you think? How do you see this? What is your advice to be able to deal with this issue? Because it's so very important and so very painful when we know your commitment, and we would very much like to hear your reflections in our debate. Thank you.
This is Eric Markert.
Yes, thanks, Barry. Thank you, Mr. Gates, for being here. Yeah, lots of points have been already raised. I try to keep it short. First point I wanted to raise is that development policy has increasingly focused on public-private partnership in the recent years. And I think an important question is how can we ensure that private investments don't just flow to middle-income or low-risk countries, but also benefit the poorest and most vulnerable regions. Second question, short question, maybe more complicated answer, but would you agree that cuts in development spending are part of a broader political trend, kind of cultural retreat into nationalism? And if so, how can we reverse this trend? And third question, what have been your biggest mistakes in the last 25 years? Or the Gates Foundation's mistakes?
Thank you, Eric. The left coordinator is not present, I don't think. So then we go to Mr. Froelich for ESN. Is he present? No, he's not present. So let's go back to Mr. Gates for your replies, please. Thank you.
Yeah, so, the short run is very grim. And the abruptness of the U.S. cuts, were completely unexpected, including, over 95% of the USAID people being let go. It was about 10,000 people worldwide, almost 4,000 of those in Africa. And so they're gone. And so even tracking what's going on, they were a very high percentage of the health expertise in Africa. For example, in Nigeria, they had 214 people, they have 0. In Ethiopia, they had 140, they have 0. So, a lot of the stories are now coming out about that, and, it should remind us, these aren't just numbers. These stories are very tough. One of the most extreme was that there was a mistake made that somebody thought a U.S. grant was for condoms for Hamas because they just did a search for the word Gaza, but in fact, that grant was to prevent babies from getting HIV in a province of Mozambique that unfortunately has the name Gaza. So it was close. It was 1,000 miles away, and it was preventing HIV instead of condoms for Hamas. So that's the kind of care that went into the cuts that took place. So we are going to, we're going to hit a low here, and, the estimates of the number of deaths involved are, still there's quite a range, but, in the end it will be over 1 million deaths because of these cuts. Now, that doesn't take us back to the 10 million a year, and at the turn of the century, people didn't, realize. So we have to remind people this is a very successful endeavor, even though we're going backwards for a period of time here. Innovation can reduce our costs. For example, the Gates Foundation was able to prove that the HPV vaccine, instead of needing 2 doses, you get full protection with 1 dose. And so not only the countries that get Gavi vaccines, but actually a number of countries, including the UK and 20 others, were able to save in their healthcare budget because we made that investment. And the ability to prove something like that, the only people who have that expertise are either the pharmaceutical companies who make the vaccine or us, because we've recruited a lot of vaccine experts in to do these cost reductions. Gavi has brought the cost of vaccines down very, very dramatically, and that's why even if we were flat funded, we could add new vaccines for things like HPV, RSV, and malaria. And, with our reductions, we'll be able to do less of that. But, we can continue to get these costs down. Some things we do, like polio eradication, that the world is spending over $1 billion a year on that, which I'm the biggest supporter of. But as we succeed with that, that goes to zero, just like with smallpox. When that was eradicated way before there was a Gates Foundation back in 1980, we haven't had to spend on that since then. And so, understanding how to get these delivery costs down and have really inexpensive drugs and vaccines is part of the reason that progress will resume. We will integrate these systems, we'll find some efficiencies, and depending on the level of generosity, we can reverse these trends in somewhere between 2 to 5 years, I believe. In terms of the private sector, there are pieces that it really won't fund. You can't do a private-public partnership for delivering basic vaccines. You can make cheap vaccines, but the actual primary healthcare system that delivers those and helps pregnant women, that's got to be funded by government funds. Those need to be very free services, providing bed nets. Almost all of education needs to be funded by government. There are some fantastic areas like electricity and roads and agriculture, super important things, many of which are climate-related activities that can be done through public-private partnerships, particularly as new technologies, the risk is taken out of them and the private sector sees that, okay, you've used this technology, a new way of making cement or steel enough times that it's, the risk has been taken out. And so now private capital can take it like they are with solar panels or electric vehicles and scale that up around the world. And so, we have areas that will always be dependent on government, both domestic and aid-type financing, and areas where if we're clever in how we grab innovation, we can draw the private sector in.
Thank you, Bill. We have time for a very quick catch the eye, and we'll take them in the order in which they requested, but we limit it to 5. So we'll begin with Mr. Kolar, EPP, if he is present. Mr. Kolar, the floor is yours. Please, 1 minute, if you don't mind. Thank you.
Thank you very much, Chair. Thank you very much, Mr. Gates, for all the remarks. I will be very brief. You mentioned Europe or the EU as one of the hubs for innovation and improvement of all the medicines and vaccines that you spoke about. What other regions do you seek help in? For example, India, to my knowledge, is a great producer of modern medicine. They have very good pharmaceutical programs, but we must be aware, of course, that not all countries and not all regimes understand aid as we do. They tend to confuse aid for corruption. So what's your take on that? Are there regions where you also seek help apart from Europe, being aware that their approach to our goals may be different? Thank you very much.
Thank you. Lara Pain, please, you have the floor for 1 minute.
Yeah, thank you, Chair. Muchas gracias.
Thank you very much, Mr. Gates. I would like to ask you 2 things. You spoke about the fact that we're still struggling to measure the impact of the USAID cuts. There have been some studies talking about 14 million victims, mainly minors, and in my country, there will be a conference on development. Unfortunately, it will be the first time the Parliament doesn't have an opinion on this. So what would you say to people who will be present here? And secondly, you spoke about the pandemic, the serious risk of an epidemic. Today, we debated our European preparedness strategy. So I'd like to ask you what essential elements we need to have in this to be better prepared. Thank you.
Ms. Morano, please.
Merci, Monsieur le Président. Pour ma part, c'est la 2e fois que j'ai la chance de vous rencontrer.
I was a member of Sarkozy's government, and I admire your work. I have a straightforward question I'd like to put to you. in line with what Mr. Mendel said, you know the African continent very well, and you know that the situation is dreadful. 1 African out of 2 lives without electricity. 600 million people do not have access to electricity. Sub-Saharan Africa has half the electricity compared with France, excluding South Africa. And I've been following your work there. My question is, what if you don't have electricity? You can't get basic services. You can't have any monitoring for a woman who's giving birth. So electrification of the African continent, is that amongst your priorities?
Robert Biedron, you have 1 minute.
Thank you very much, Chair, and thank you very much, Mr. Gates, for being with us. And we live in terrible times where multilateralism is being questioned, sustainable development goals are being also undermined, and with this we are also losing our financial structure composition. And you are campaigning for many years for the fair taxes. You yourself, you said if you were to design the tax system, you would be billions poorer. I would love it. That would be very fair. But on the other side, of course, you would not do all these good things. So my question would be how to make this world more fair in the financial structure, that we will deliver all these needs we're discussing today, where member states are stepping down, cutting their ODA, their engagement in humanitarian financing, development financing, and how should we construct this world that the rich will pay finally fair taxes, which will devote to all these needs discussed. Thank you very much.
Thank you, Robert. Anna-Maja Henriksen, 1 minute.
Thank you, Chair, and thank you very much, Mr. Gates, for being here. It's wonderful to have this opportunity, and thanks for everything that you have done for the poorest people in the world. We are very grateful for that. Now I would also like to hear from you, what are your wishes in terms of cooperation with the EU and the member states? Have your foundation wishes towards us? Because we know the situation is very complicated. We know that we should do more and not less. But as you see it, what can we do to be a part of the solution in the future to get more people out of poverty, more children to school, to have them educated and to make them alive? Thank you.
Thank you, Anna-Maja. So, Mr. Gates, thank you. You've those questions and comments and an opportunity for some concluding remarks as well. Thank you. The floor is yours.
Yeah, in terms of tax systems, every country is very different, and the only one I know well is the United States. One thing that is always surprising to me is the United States is one of the few countries that has a serious estate tax. And so instead of having dynastic wealth that gets passed down, generation to generation, we have a 55% estate tax. And one of the ways that the United States motivates people to give money is that they say if you give the money away, it's exempt from that estate tax. And so you can think, okay, once I take care of my children at some level, I can have much more money on the philanthropic side, and so I at least ought to consider that. But there are people who are more progressive. Piketty is more progressive than I am, but I'm maybe halfway in between the current U.S. system and Piketty. So I would have about a third as much money as I have under that tax system. Under his system, I'd have about 5%. So reasonable people disagree about tax systems. Weirdly, China doesn't have an estate tax. So this is called the communist country, and we're called the capitalistic country. So tax systems, it's very complex. The question about where can we get low-cost products, absolutely Gavi and all the things the Gates Foundation does, we look all over the world. And so India actually, for low-cost vaccines, they're not often the first to do a vaccine, but over time, as the vaccine matures, they'll often do a very low-cost version. And so we support Serum, Bharat, BioE in India, and Biopharma in Indonesia that make a lot of these very, very low-cost vaccines. And we're interested, we're funding some work in different parts of the world, including some in Africa, so we have lots of sources of that supply. The beauty is that you can go through the WHO pre-qualification effort in order to make sure you have global quality. And so the foundation works very closely with WHO PQ to make sure that they're fast and very accurate. They kind of serve as the regulator for all of the low-income countries. It's very hard to measure the impacts of these cuts. And so you'll see numbers that vary by a factor of 3 or 4 because you have to think, okay, is it the cuts over time or is it just the near term? Take HIV. If people don't take their HIV medicine and they're an adult, they don't die right away. They live quite a while and they infect other people, but then they're very sick and they overload the health system, and so their life expectancy is about 6 years. With malaria, you get deaths very quickly. The fact that the bed nets have not been handed out, we'll see that very quickly in the numbers. Other things like the lack of food aid, that drives malnutrition, which, over time, we know that almost half of all childhood deaths could be avoided if children were well nourished. And so, the people who are against aid will say, oh, your numbers aren't consistent as we go through the various scenarios. And, that's fair. But, we can say for sure it's over 1 million lives will be lost in the next several years because of these cutbacks, primarily the U.S. cutbacks. The importance of electricity is, absolutely correct. There are other parts of the economy like agriculture and agricultural processing that actually can be done with modest amounts of electricity, so we should definitely prioritize that, but we also need a plan, whether it's through renewables or other techniques to help Africa get electricity. Some people would disagree whether Africa should be allowed to use the natural gas that Africa has, because it's such a small part of emissions, although that would add to emissions. You could have a healthy debate about, is it okay to finance natural gas plants in African countries, but their population has gone up more than their electricity has. So the amount of electricity per person in Africa is actually less today than it was 10 years ago. So certainly a need, and as we make advances, we get solar cheaper and other clean forms of energy, we should help bootstrap that, and that will be great for the African economy. So let me just close on the question about how we see the most beneficial partnership between ourselves and the EU. I mentioned that we spend as much on research as we do on delivery, and so you have a fantastic research budget, and so we want to find common goals like, maybe a gene edit that's very inexpensive to cure sickle cell or to cure HIV. And so some high-reach goals, the next generation of vaccines for all of these diseases. So we see research, cooperation on the research side as very, very important. We've done some of that to date, but there's room to do 10 times as much, I would say, because there's incredible talent here and people who will respond to that opportunity. The second is you think about Global Gateway. Our request is that you clearly identify the portion of that amount that is to help the low-income countries. There's a lot of things Global Gateway should do, but having clarity on what portion of that you would expect to go to the cause of human development, will give us clarity and allow people to plan that, okay, Europe's going to be there both at the community level and at the nation state level as a great partner. In this time when people are so transactional, the fact that you're able to make 7-year MFF structures and largely modular, gigantic surprises stay true to that makes a huge difference. This is a game of consistency, building up the expertise, having these countries know that they can count on these partnerships, and accelerating the date to where we go back to getting these deaths to start going down again. So, my optimism has a lot to do with the values that you bring as a very strong partner. Thank you.
So it just remains for me to, on my own behalf and on behalf of the committee and the ITRE committee, to thank you for your energy, your dedication over so many years and your partnership, and to thank and congratulate the Gates Foundation for all it has achieved. And we really, really appreciate your coming to, as one of the world's leading advocates for development, to come and share your thoughts with the committee today. So as Mr. Halvany pointed out, we'll see you all tomorrow for the Development Committee. Thank you, everybody.